What's up, everybody? This is the updated precautions video as of August 2024. We have realized there's some new updated information from the CDC regarding COVID. So we're updating that. If you just want a quick update of what that is, basically COVID precautions are officially airborne precautions. If you got that under your belt and you're like, okay, good, sounds good, Bria, I watched this before with the old version, just switch that information, you're good. But if this is the first time you're watching this, welcome to the precautions video. The number one thing I want you to take away from this video, wash your damn hands. Or if you're listening to this in audio form from this podcast or audio form that you're listening, wash your damn hands. It is the number one way to reduce the spread of infection. Here's the thing. Hospital-acquired infections or nosocomial infections are the number one cause of infection in hospitals, like newfound infection. And so here's the thing. These are going to come from other hospital workers coming in and out of patients' rooms and stuff like that. So that means that these are 100% the fault of the healthcare provider, which also means it's 100% avoidable. So we're going to take proper precautions with the patient, wash your damn hands, and make sure we don't get the patient infected with any disease. So standard precautions are used for pretty much every patient. This essentially means hand washing, gloves, gown. Those are some of the big things, but basically big things are going to be hand washing and gloves. So if you're just going to a patient's room, they don't have any official precautions. You're washing your hands and using a glove. So you're going to be basically using antimicrobial soap. You need to wash your hands for at least 20 seconds, which apparently is a happy birthday song twice. Get under your nails, between your fingers, the backs of the hands, you'd be surprised. Next time you wash your hands, really think about where am I actually washing? And you'll notice there's probably a lot of places on your hand that you're not really scrubbing as well as you should be. So always wash your hands, especially if your hands are soiled. So if you have any sort of I don't know what you would get on your hands, dirt, bodily fluids, poop, whatever ends up getting on there. If you're exposed to that, you need to wash your hands. Yeah. That's a big thing. So if your hands are visibly soiled, always wash your hands. If you went into a patient's room, just maybe you rearranged some stuff, maybe you didn't even really treat the patient at all, and you come out of their room, you can use some hand sanitizer for that. But if they're soiled, you absolutely 100% have to use soap. And if they're under any specific precautions, so if they're not under any specific precautions, that's when, and you don't have anything on your hands, you can use hand sanitizer. But if they're under any of the following precautions we're about to talk about, they need to have hands washed. That's mandatory, regardless if they're soiled or not. Gloves will be used with every patient. If they have a latex allergy, be aware and just make sure the gloves don't have latex in them. Gloves should be used with any patient, but especially if you're going to be coming in contact with bodily fluids or blood. So that means if you are treating a patient, an outpatient, and they have a scab on their leg and it's bleeding, or maybe they have exudate coming from their knee replacement wound or something like that, you need to wear gloves to address that. So you're going to change gloves between patients. That's pretty self-explanatory, but sometimes people are reading a question so fast, they don't realize that they're like, oh, the gloves were never changed. We need to change our gloves, because you don't want one person's cooties going on another person's cooties. Not good. Face shield, mask, or any sort of other eye protection like goggles that will be used to protect yourself from especially droplet precautions when there are fluids splashing. I'll let you have your imagination with that. Yeah, nasty. Anyways, gown will be used to protect against bodily fluids getting on your person. So here's the thing about the gown. The gown is only sterile in the front and above the waist. So the sleeves are sterile, but if the gown, so above your waist and your sleeves in the front, that is the only part of the gown that's sterile, which means below the waist in the front is not sterile, and the entire back of the gown is not sterile. I don't care if it's above the waist. If it's on the back, it's not sterile. So just remember that. I would just pause and make sure you understand that. If we want to split the body into top half, bottom half, and front back, the only quadrant that is sterile is the top front part of the body, if we want to think of it that way. So airborne precautions, this is the big update. COVID-19 is officially under airborne precautions for the boards. So it was kind of like 50-50 if it was airborne or droplet. They officially put it under airborne. Again, this is under with tuberculosis or varicella. Those are going to be big ones. So standard precautions are going to be used: wash your hands, gloves and gown. Mask will be worn with this patient. It'll be a specific N95 mask that you have to get fitted on you. It's to prevent transmission of the disease. It could be a respirator as well. So it has to be an N95. Cannot be a surgical mask. I'll say that again. It cannot be a surgical mask. You're like, but Bree, we wore that during COVID times. Well, that was a Wild West, man. We were trying not to die. We had bigger things to worry about. Room modifications for this patient. They will be in an isolated negative pressure room, which means they're by themselves. All by myself. That's where they are. Anyways, it's going to be a negative pressure room, which what does that mean? That means pressure is coming from the outside of the room into the room, because the air cannot go from the inside of the room out because that's spreading disease. Air is coming from the outside in. Okay, so there's 6 to 12 air changes per hour. The board says that. I don't really know what that means. I'm sure the HVAC people have an idea. So I guess if you switch to PTA from HVAC, if you want to hit me up and let me know how that works, I'd love to hear it. But anyways, the room door remains closed. So you cannot open this door unless you're going into the room to work with the patient. Don't take anything from the room. Don't bring anything in. Everything stays in the room. Ideally, the patient will wear a mask as well. I know this isn't ideal for every patient. Maybe they have a lot of tubes connected to them. Wearing the oxygen is too complicated. But again, if the patient has to leave the room, it's absolutely mandatory that they are wearing a mask. Testing will most likely be done in the patient's room. So if they have to bring like an ultrasound in or view something or do some sort of testing, it's done in the patient's room. Again, I guess you can't really bring an MRI machine in there. So if they leave the room, they will wear a mask, 100% mandatory. Now, droplet precautions. This is what we thought COVID was, but now it's like splashing, coughing, disgusting viral and bacterial diseases. So there's an exhaustive list inside of the Score Builders book. I believe there's also an exhaustive list inside of the Therapy Ed book as well. But the most common ones you're going to see are for the flu, so influenza, pneumonia, meningitis, any sort of sepsis, which is usually a staph or a strep infection. So those are on there as well. Pertussis, which is whooping cough, mumps, measles, rubella, which is what's in your MMR vaccine. So standard precautions will happen for this patient. So hand washing, mask, gloves, and gowns. Eye, hair, and foot protection is going to be recommended. So things aren't splashing in your face. Yeah, gross, right? Yeah, splashing. We don't want it going in the eye membranes. We don't want it getting into the hair. We don't want it getting onto your feet. Ugh. Room modifications. Essentially, the patient can be in a room with somebody else who has the same disease as them. So if 2 people both have mumps, like there's some sort of mumps outbreak, and like let's say 2 kids get mumps and their brother and sister, and that's all they have, they can sit in the same room together. So again, the room door can be open, just patients can't get within 3 feet of leaving the room. If they are going to leave the room, they absolutely have to wear a mask. And if the patient is able to, we would like them to wear a mask as well while we're in the room with them. But 100% if they leave the room, they have to wear a mask. And mask is mandatory for anybody working within 3 feet of the patient. So that's a big thing with this one. Now, contact precautions. So these are going to be common for a lot of our integumentary diseases and for our GI diseases. You see this on the side. This is called Giant Microbes. It's a cool company that sells plushies of microbes, and I just think they're so cute and they seem less threatening, but I don't know. This is the cutest C. diff you'll ever see in your life. But again, C. diff is one of them. E. coli, shingles, which is our herpes zoster virus. That's also on there. Ebola, hepatitis A, diphtheria, herpes, impetigo, pediculosis, scabies, all of this sort of stuff. So yeah, so like bed bugs. Woo, yay. So you're using standard precautions, so hand washing, gloves, and gowns. You don't need a mask because it's not droplet. It's not going to enter the lungs or anything like that, so you're good. But room modifications, again, if you got 2 people who both got the diff, they both can sit in there together with their C. diff. That's fine. Room door can be open. You must have hand washing before, after, while you're in the room with the patient. So you have to make sure you wash your hands before you leave the room. Obviously, you'll wash your hands before you go into the room, but you have to wash your hands in the room in the sink before you leave. Patient equipment must remain in the room with the patient. It's not going out changing from patient to patient because it's an integumentary disease, and you're going to minimize the patient transport. You really don't want to move them around outside the room. So that's what's happening with contact precautions. Again, no mask needed, just gloves and gown, and wash your hands in the room. Those are the big things for this one. All right, friends, sample question. A physical therapist assistant is treating a patient diagnosed with tuberculosis. Which of the following types of precautions is most appropriate to use with this patient? 1, place the patient in a positive pressure room. 2, wear a surgical mask. 3, gloves. Or 4, keep the door open while treating this patient. So I'll give you guys a second to think about this. All right, guys, so the answer is gloves. Don't overthink this. So let's look at this. Patient has tuberculosis. What do we know about that? That's going to be airborne precautions. So let's look at their answers and see if they're consistent with airborne precautions. 1, place the patient in a positive pressure room. It's got to be negative pressure. Positive pressure means the air is leaving the room. We need to make sure air is going into the room. So we don't want air from the room going to the outside. So again, positive pressure, nope, it's got to be negative pressure. 2, surgical mask. And surgical mask is not good enough. It's got to be the N95. So not good enough. Boom. Fail pretty much with that one. Gloves, yes. Remember, we're wearing gloves with every patient who has these any sort of precautions. Gloves are always going to be an option. So gloves is appropriate to wear with this patient. 100%. And you're wearing other stuff, but you need to be wearing gloves as well. 4, keeping the door open. Absolutely not. We are closing the door. Negative pressure. We don't want the door open. We don't want those, airborne tuberculosis cooties leaving the room. So again, that's the big thing for treating these patients of different types of precautions. And remember, precautions apply to everyone regardless of your vaccination status. So if you're treating a patient with, let's say that they have measles or mumps or something like that, like those 2 kids in the room that I was referencing earlier. If you have your MMR vaccine, you still need to wear all the appropriate precautions. Okay. Remember, vaccines keep you from getting hospitalized. They don't keep you from getting the disease. So just remember, regardless of your vaccination status, with any of these conditions, whatever we're talking about, you're always, always, always wearing all the protective equipment. Okay. So I've seen some people go down a rabbit hole messing up a question because of that. Just assume it's all the same, because it is all the same, regardless of vaccination status of you or the patient. Everybody's precautions are going to be the same for whatever precaution that they're under. So just wanted to clear that up as well. All right, friends, I'll see you on the next one. And don't forget to wash your hands. Bye, guys.